Today, we will be delving into the fascinating world of gastric emptying scintigraphy, GES, and its various applications in clinical practice. GES is a valuable diagnostic tool used to assess gastric motility and evaluate the dynamics of gastric emptying. In this comprehensive script, we will explore the nuances of GES, along with its quantification methods and its applications in different clinical scenarios. So, let's delve into the world of GES and uncover its hidden treasures. In conclusion, there are several quantification methods in gastric emptying scintigraphy, GES, that allow for the assessment of gastric emptying rate and pattern. These methods include calculating gastric emptying half-time, gastric retention at specific time points, and using geometric mean or cumulative counts. These techniques provide valuable information for diagnosing gastric motility disorders and making clinical decisions. GES serves as a valuable tool for assessing various gastrointestinal dysmotility disorders. By analyzing gastric emptying patterns, it can help identify patients with gastroparesis, a condition characterized by delayed gastric emptying. Gastroparesis is commonly associated with symptoms such as early satiety, nausea, and vomiting. GES aids in diagnosing and determining the severity of gastroparesis, guiding treatment strategies and improving patient outcomes. In addition to gastroparesis, GES can also detect other gastrointestinal dysmotility disorders such as antral hypomotility, duodenogastric reflux, and small bowel dysmotility. By evaluating the rate of gastric emptying, GES aids in the accurate assessment of these conditions and facilitates tailored management approaches. Diabetes mellitus is a systemic disease that can significantly impact gastric motility. GES plays a crucial role in evaluating gastric emptying in patients with diabetes. It assists in determining the presence and severity of diabetic gastroparesis, a common complication in these individuals. Patients with diabetic gastroparesis often experience delayed gastric emptying, leading to symptoms such as bloating, abdominal pain, and erratic blood glucose control. GES helps quantify the degree of gastric emptying delay, aiding clinicians in developing individualized management plans to optimize glycemic control and alleviate symptoms. GES provides valuable insights into the severity of gastroparesis. By measuring parameters such as gastric retention at specific time points, the rate of emptying, and half-time, GES helps categorize patients into different severity groups. This information is vital in guiding treatment decisions, such as diet modifications, medication adjustments, and potentially surgical interventions. GES allows for an objective assessment of gastroparesis severity, ensuring appropriate management strategies are implemented. GES is not limited to adults, it also plays a vital role in pediatric medicine. In children, GES helps evaluate various gastrointestinal disorders, such as chronic vomiting, feeding difficulties, and suspected gastroparesis. By assessing gastric emptying dynamics, GES assists in diagnosing and managing these conditions in pediatric patients. It offers valuable information for clinicians in terms of treatment planning and monitoring treatment response. Following gastric surgery, some patients may develop complications related to gastric motility. GES serves as a valuable diagnostic tool in this context, aiding in the assessment of surgical outcomes and the detection of complications such as gastric stasis, anastomotic strictures, or dumping syndrome. By analyzing gastric emptying rates, GES provides clinicians with objective data to guide further interventions or modifications to the surgical approach. This assists in optimizing post-surgical outcomes and improving patient well-being. Medications can significantly impact gastric motility and emptying rates. GES allows for the assessment of how different medications, such as prokinetic agents or anticholinergic drugs, influence gastric emptying times. By studying the effects of medications on GES parameters, clinicians can make informed decisions about prescribing or adjusting medications for patients with gastric motility disorders. This ensures optimal management and minimizes potential adverse effects. GES plays a crucial role in the evaluation of gastric outlet obstruction, a condition that impairs the normal flow of gastric contents from the stomach to the duodenum. By assessing gastric emptying patterns, GES helps identify the presence and severity of such obstructions. Additionally, GES can determine the underlying etiology of the obstruction, such as pyloric stenosis, peptic ulcer disease, or malignancy. This information guides treatment decisions, ranging from medical management to surgical interventions, ensuring timely and appropriate care for patients. Combining GES with single photon emission computed tomography/computed tomography, SPECT/CT, imaging offers enhanced localization and anatomical context in gastric motility assessment. By integrating functional and anatomical information, this hybrid imaging modality provides valuable insights into the precise site and nature of gastric motility abnormalities. This assists in planning interventions and optimizing patient outcomes. Advancements in radiopharmaceuticals have allowed for improved accuracy and precision in GES. The development of novel radiotracers, such as technetium-labeled compounds and positron emission tomography, PET, agents, has enhanced the diagnostic capabilities of JIS. These new radiopharmaceuticals provide better image quality, more robust quantification methods, and potential applications beyond traditional JIS. Ongoing research in this field continues to shape the future of JIS and its clinical utility. Dumping syndrome is a condition characterized by rapid gastric emptying, leading to various gastrointestinal symptoms. JIS plays a pivotal role in assessing dumping syndrome, aiding in its diagnosis and management. By evaluating gastric emptying dynamics and assessing the presence of associated symptoms, JIS assists in distinguishing between early and late dumping syndrome variants. This information is crucial in guiding dietary modifications, medication management, and potential surgical interventions. Functional dyspepsia is a common gastrointestinal disorder characterized by chronic or recurrent upper abdominal pain or discomfort. JIS serves as a valuable tool in evaluating patients with functional dyspepsia, aiding in the identification of gastric motility abnormalities. By studying gastric emptying patterns, JIS helps differentiate between delayed gastric emptying and normal motility in patients with functional dyspepsia. This aids in tailoring management strategies and improving patient satisfaction. Gastric emptying scintigraphy, GES, is a valuable diagnostic tool used in gastroenterology and radiology. It provides objective data on gastric motility, aiding in the diagnosis and management of gastrointestinal disorders. JIS will continue to advance, allowing for more personalized patient care.